I'm Dr. Squires at the Center for Healing Neurology. Today we're going to do platelet-rich plasma. Matthew has pretty severe osteoarthritis of his left hip. He's had stem cells and some PRP, which has worked pretty well. And he's just trying to avoid a hip replacement so young. So he's doing regenerative medicine, which has been working pretty well. You were saying the other day that you've had pretty good quality of life. You're not having any pain. Your range of motion's better. So we're taking 50 mils per syringe, so 100 total, 50 mils of blood per area. And that gives us about 7 mils of platelet-rich plasma. So I'll take this whole red blood and I will spin it down a couple different times at different speeds to get the most potent platelet-rich plasma. We are creating an inflammatory response, so from anywhere from 1 to 4 days, people will usually have increased pain because we're signaling the body that it needs to come heal this area. After about anywhere from 2 to 4 days, people have pain reduction after that and prolonged for months. Sometimes people need to come in for a PRP booster once in a while, but for the most part, after 1 to 4 treatments, most people are pain-free. So we're going to just take the platelet-poor plasma, we're going to spin it again so that it will then again separate, and we're just going to get the platelet-rich plasma. All right, so this is our final product. The reason we spun it for so long, we wanted to drive down all of those platelets in here, and you can see them at the bottom. There are some red cells in there, which is fine, and there's also those platelets, which has all the growth factors. So at first I'm just going to pull off some of this platelet-poor plasma so we get the most concentrated dose of platelet-rich plasma. And so this is the amount that's going to be used. It has some red blood cells, which are good because that can stimulate even more of an immune response. For some conditions, you might want to get them all out, but for this condition, this is exactly what we want. This is the liquid gold. Okay, so we're going to use ultrasound for the hip injection because it's an intra-articular injection. We want to make sure that we are in the joint and at the area of injury. So we're going to go right there to that spot. Okay, Matthew, you ready? And 1, 2, 3. There we go, right in our spot. 1, 2, 3. And you're done. So for Matthew, some of his hip pains comes from instability of his lower back, his SI joint, and his iliolumbar ligament. So we're just going to do a little prolotherapy in those just to help stabilize that so that that will help with his hip pain, the PRP that we just did. 1, 2, 3. 1, 2, 3. 1, 2, 3. And 1, 2, 3. And you're done.